Welcome to Medical for Dummies. Medical stuff, easily explained. Hit the like button if you want to become smarter than your general practitioner. And remember, this is not medical advice. Always check with a doctor or call the emergency services when you're in urgent medical need. Today's subject is about diabetes mellitus, or for short, diabetes. Diabetes is a metabolic disease that lasts for a long time and is marked by high blood sugar levels. Millions of people all over the world face major health risks and effects from it. Diabetes is caused by either not making enough insulin or not using it well enough. This leads to abnormal glucose metabolism. This condition can have a big impact on a person's quality of life and requires a lot of care to avoid problems and keep their overall health up. Different types of diabetes. There are different kinds of diabetes, and each has its own reasons, symptoms, and ways of being treated. Type 1 diabetes, also called insulin-dependent diabetes, is an autoimmune disease in which the body's immune system attacks and kills the beta cells in the pancreas that make insulin. Because of this, little or no insulin is made. People with type 1 diabetes need insulin shots or insulin pumps to control how much sugar is in their blood. Usually, this type is found in children or teenagers. Most people with diabetes have type 2, which is the most common form of the disease. The main reason it happens is that cells don't respond to insulin as they should. This is called insulin resistance. Over time, the pancreas may start to make less insulin. Type 2 diabetes is often caused by being overweight, not being active enough, or having a gene that makes you more likely to get it. It can be managed by making changes to your diet, taking pills, getting shots, or, in rare cases, insulin treatment. Insulin resistance can also happen during pregnancy because of changes in hormones. This is called gestational diabetes. Even though most cases of gestational diabetes go away after the baby is born, women who have it are more likely to get type 2 diabetes in the future. For this illness to be controlled during pregnancy, blood sugar levels must be closely watched and a healthy diet must be followed. Types of diabetes that happen less often are called secondary diabetes and monogenic diabetes. Diabetes that is caused by changes in only one gene, or is monogenic, is often found in young people. Secondary diabetes can be caused by other health problems or medicines that affect how insulin is made or used. Symptoms of diabetes. Diabetes symptoms can be different depending on what kind of type it is and how bad it is. Some typical signs are frequent urination. If your blood glucose level is high, you may have to go to the bathroom more often because you make more pee. Dehydration can be caused by urinating a lot, which can make you feel very thirsty. Unexpected weight loss. If you have type 1 diabetes, your body may start to use fat and muscle as a source of energy. This can cause you to lose weight. Increased hunger. Insulin resistance can stop cells from getting enough glucose, which can make you feel hungry for a long time. If you don't use glucose well, you might feel tired and weak. Vision blur. High blood sugar can damage the lens of the eye, making it hard to see. Wounds and infections may take longer to heal in people with diabetes. Long-term high blood sugar can damage nerves, which can cause burning, stiffness, and pain, especially in the limbs. Diagnosing diabetes. Blood sugar readings and, in some cases, other tests are used to figure out what kind of diabetes a person has and how bad it is. Here are some common ways to find out what's wrong. Fasting plasma glucose test. This test checks how much sugar is in the blood after at least 12 hours of not eating. Blood sugar levels of 126 milligrams per deciliter or more in the morning are usually enough to tell if someone has diabetes. Oral glucose tolerance test, OGTT. The OGTT is done by fasting for 12 hours and then drinking a solution that is high in glucose. After that, the blood sugar level is checked on a daily basis. A blood sugar reading of 200 milligrams per deciliter or more 2 hours after drinking the solution is a sign of diabetes. Hemoglobin A1C test. This test measures how much sugar has been in your blood on average over the last 2 to 3 months. A1C levels of 6.5% or more are often used as a way to tell if someone has diabetes. Random blood sugar test. No matter when the person last ate, a blood sample is taken at a random time. If you have signs of diabetes and your blood sugar level is 200 mg per deciliter or higher, this could mean you have diabetes. Methods of treatment. The goal of treating diabetes is to keep blood sugar levels under control, avoid problems, and improve general health. Depending on the type of diabetes, there are different ways to treat it. Treatment of type 1 diabetes. Insulin therapy. People with type 1 diabetes don't make much or any insulin, so insulin treatment is very important. This means getting insulin shots on a daily basis or using insulin pumps, which give insulin all day long. Blood sugar monitoring. When people check their blood sugar levels often, they can change their insulin amounts and better control their levels. Carbohydrate counting. To keep blood sugar levels normal, it's important to keep track of how many carbs you eat and how much insulin you take with each meal. Treatment of type 2 diabetes. Changes in lifestyle. Eating a well-balanced diet, being physically active regularly, and staying at a healthy weight can help insulin sensitivity and blood sugar control. Oral drugs. Different oral drugs help lower blood sugar by making insulin more sensitive, stopping the liver from making glucose, and slowing the absorption of carbs in the gut. Injectable medications. GLP-1 receptor agonists and SGLT2 inhibitors are two types of injectable medications that may be given to help control blood sugar and help with weight loss. Insulin treatment. As type 2 diabetes gets worse, a person may need insulin therapy to get the best control of their blood sugar. Treatment for gestational diabetes. Blood sugar monitoring. Keeping an eye on the mother's and baby's blood sugar levels helps make sure they stay in a safe range. Dietary changes. To control blood sugar levels during pregnancy, it is important to eat a healthy diet that limits carbs. Physical activity. Light to moderate exercise can help make the body more sensitive to insulin and help control blood sugar. Insulin therapy. If lifestyle changes don't bring down high blood sugar levels, insulin treatment may be needed. Complications and ways to avoid them. Diabetes that is not under control can cause a number of short-term and long-term problems, such as heart disease, kidney damage, nerve damage, vision problems, and slow wound healing. Among the preventive steps are blood sugar control. Keeping blood sugar at the right level through treatment and self-care lowers the chance of problems by a lot. Managing blood pressure. Keeping blood pressure at a healthy level is important to avoid heart and kidney problems. Cholesterol control. Taking medicine and making changes to your lifestyle can help you control your cholesterol levels and lower your risk of heart disease. Regular checkups. Regular medical checkups let doctors keep an eye on how diabetes is being treated and spot problems early. Care for your feet. Keeping your feet clean and getting regular checkups can help you avoid foot sores and illnesses. Eye exams. Regular eye exams can find diabetic retinopathy, a common eye problem caused by diabetes, and treat it. In the end, diabetes mellitus is a complicated metabolic problem that needs to be fully understood in terms of its kinds, symptoms, diagnosis, and ways to treat it. People with diabetes can live healthy, happy lives and lower their risk of problems if they know how to take care of their condition. That's it for this episode of Medical for Dummies. We hope to have made you a little bit smarter. Drop a like on our channel, and see you next time.